Hello everyone and welcome to this presentation on the needs for orthosis and prosthesis in lower and middle income countries. In this short presentation, we will explore why orthotics and prosthetics are urgently needed in lower and middle income countries, why local production matters, and how new technologies, especially 3D printing, are transforming access to assistive devices. Worldwide, there are 65 million people affected with limb loss, and 64% of them live in lower and middle income countries. The demand in orthotics devices is also increasing drastically, fueled by the increase in non-communicable diseases and the increase in aging population. But in many lower and middle income countries, only 5 to 15% of those who need these devices receive them. This means that the vast majority of people with limb loss, neuromusculoskeletal impairment, congenital conditions, or trauma are left without the tools they need for basic mobility. Without functional assistive devices, individuals face barriers to education, employment, and social participation. In 2022, the World Health Organization estimated approximately 25 million of people in need of P&O devices in Africa, Asia, and Latin America. Why is access so limited? Traditional P&O manufacturing relies on manual craftsmanship, imported materials, and specialized equipment, and this leads to several barriers like high cost, as imported components are expensive, long waiting times, devices take weeks or months to deliver, limited geographical coverage, as services are often concentrated in major cities, and dependence on external supply chains, and disruption in supply chain can halt production entirely. The shortage of trained prosthetists and orthotists is typical example. In 2024, the whole of Botswana counted only 11 prosthetists. Local manufacturing is a game changer. When orthotic and prosthetic devices are produced locally by using local available materials, simplified fabrication methods, or emerging techniques like 3D printing, the cost can drop dramatically. Local production also ensures faster delivery, easier repair, and adaptation to cultural and environmental needs. Most importantly, building local capacity by training professionals. This creates jobs and establishes sustainable healthcare systems that are not dependent on donations or imports. Ensuring access to affordable, locally manufactured P&O devices benefits healthcare systems at multiple levels by improved rehabilitation outcomes. As patients regain independence faster, people can return to work, schools, and social life, and this enhances community participation. Independent mobility reduces caregiving needs and increases productivity, thus ensuring long-term economic benefits. Local production models combined with outreach services allow clinicians to travel to communities, take digital scans, fabricate devices locally, and return to fit patients. This greatly improves access in remote regions. A case study of 3D printing of transtibial socket in Rwanda. Clinicians measured the size of stump to determine the size of liner. The pressure tolerant and pressure sensitive areas are marked over the stump, and then a scan is taken. A lightweight 3D printed socket design is produced by using patient scans. During the first fitting, the patient can complain of uncomfortable pressures on residual limb and poor suspension. And based on the feedback, the adjustments are made to improve pressure distribution and suspension. The optimized socket is comfortable, cheaper, and lighter. This case shows how iterative prototyping, design, test, feedback, and refine is essential to creating effective biomedical solutions. In summary, prosthetic and orthotic devices are essential for health, independence, and dignity. Expanding local production supported by digital technologies like 3D printing is a powerful way to address the unmet need in lower and middle income countries. To close the global gap, we need investment in local production, training programs, community-based rehabilitation, and innovation tailored to lower and middle income country realities.